I'm from Vijayawada Hospital for Children, a second year DCH student.
Hello. Sir, what was your experience of simulation?
To be honestly speaking, I did not expect much when it started. I thought it would just be another demo with a mannequin, but the prototype that we have here, which is actually a high fidelity, like it's very responsive, like it can perform a lot of functions, and that along with the monitor and the changes there and the whole experience that was created was really helpful in learning.
What you want to be improved here?
I really like the scenario. The only thing that I wanted was like more and more such scenarios that we can cover that can help us. If more such scenarios are covered, we cover like all the sets of different symptoms. And more so, if we could also perform more procedures like intubations and other central line procedures that we don't normally get in some of the hospitals, if we can also include that in the.
So you want to come again for more workshops?
Definitely.
And what is your take-home message?
Take-home message was first thing that, as we said, like we always taught in India that patients have to unpick earlier, but being a doctor, we know that sometimes it actually does hurt the patient in the early years. If we can actually do it on them, we'll have more confidence, it will help the patients better, and it will help us become better pediatricians.
Your name, sir?
My name is Dr. Ujjwal Solanki. I am from Porbandar Civil Hospital, Gujarat.
Okay. Sir, what was your simulation experience?
First of all, it is new for us. We have learned so many things about some equipments which are not using in our hospital. We have learned about that, and it is real-time experience for us.
Okay. So what you want to be improved?
As per my advice, some more procedure that we need to learn, which are not actually we are doing in our hospitals. For example, more intubation skills and all, some emergency conditions, that some pneumothorax scenario, that needle decompression and all, that we want to learn more about it.
So you will be happy to come again for the workshop.
Yes, I will be happy to come.
And what is your take-home message?
We want to learn more scenarios about, for example, some that we have learned acute exacerbation asthma. We have left that status athletics and all that I want to learn about.
Myself, Dr. K. Trivedi. I am second year resident at Padma Hospital, Rajkot.
So what was your simulation experience?
Actually, this was our first experience regarding simulation lab. So before coming here, we have seen the video that this kind of mannequin is there, but we were not sure that it can be this much multi-organ system involvement, high fidelity mannequin that give you a real life practical scenario which you actually can correlate with your patient regarding how the patient will arrive or reach up to us and how you will act accordingly. So it is really giving you a basic idea that how you can approach the patient, how you can really deal with the real life scenario, and how you can actually improve your skills and approach towards it.
What you want to be improved?
Actually, as per earlier, everyone is saying that if there is a more case scenario, it will be very grateful for us, because like you can actually correlate what you are thinking and what you are actually doing is very different thing. Because if you know the theory but you cannot apply it in the practical setting, it is very mismanaged about the patient thing. But what is more important is, what I like about is after the simulation lab there is also a discussion about it, so you will know that what went wrong at what stage and what you can improve from that on next word or on your next training session or in practical setup as well.
Okay. And what is your take-home message?
As we know that this is one of the kind simulation lab happening in CPS and in our country as well, because there are not much labs like this available. So if there will be much labs available, there will be better for patient safety and patient care, that everyone will get a privilege and advantage for them to learn the skills as well as this kind of scenario, so they can apply and improve their knowledge and skills about being a good pediatrician someday.
So you're happy that CPS has taken this?
Yeah, definitely, because this is very a new and good approach by CPS, that we will able and we were privileged to have this kind of lab session at CPS Mumbai.
Hello, I'm Dr. Akanksha from Vijayawada Hospital for Children, and I'm a second year DCH resident.
Ma'am, what was your simulation experience today?
The simulation experience was great. I could learn a lot and I could practically apply it during emergency situation. It helped me to channelize my approach and the protocol based. That's it.
Okay. What you want to be improved?
Again, likewise, everyone said that more of case-based scenarios, but we have time restraints. So frequency of these workshops should be more often so that we get to learn and apply it.
Okay. And your take-home message?
Take-home message was the way the simulation was conducted, the real-time scenarios which was given. As initially we thought it was more of lecture-based, but it was more of real-life situations. So we could analyze and we could that time channelize the approach.